Hi, my name is Alex Giddens, and I'm recording my health assessment head-to-toe video for Maryville University. This is my subject, John Giddens. He's agreed to do this, so I hope you guys enjoy. Before he'd entered the room, the first thing I wanted to do was make sure that I'd gotten a full set of vitals on him, a height and a weight. I assessed his vision with the Snellen chart, which all came back fine, and I also went ahead and had him change into a gown and empty his bladder. As he walked into the room, I assessed his gait, making sure that he was steady and balanced on his feet, and I also assessed his breathing to make sure he was non-labored and he wasn't short of breath or dyspneic, which all became fine. So as he's sitting here now, the first thing I'm going to do is the least invasive, which I'm going to go ahead and inspect first. I'm going to look at his head. I want to make sure that we look for any signs of trauma, any lesions, any bulging. I want to make sure that his head is round and cephalic. Make sure that we don't notice any indentations, which I don't. The only thing that I want to check next is make sure that the eyes and the ears are proportionate to his face and make sure those are symmetric as well. After you do a visual inspection, you want to make sure you do your palpation. You want to feel around on the head and the scalp to make sure that the scalp is freely movable, that there's no pain on palpation, and that you've noticed no lumps, bumps, bruises, or trauma noted. While you're doing the palpation on the head, you can also do a palpation on the hair. You want to make sure that the hair is evenly distributed, that it is not coarse or damaged, and you also want to make sure that there's no signs of any abnormalities such as alopecia. After you go ahead and do the assessment on the head, you want to make sure that you assess a few of the cranial nerves by asking him to follow some simple commands. Can you go ahead and wrinkle your forehead? Can you go ahead and squint your eyes? Can you close them tightly? Puff out your cheeks. Smile. Then stick out your tongue. Perfect. And move it left to right, make sure that you have no issue with that. Awesome. Okay, you also want to palpate the face looking for any abnormalities. You want to look at the temporal mandibular joint, making sure that there's no clicking, popping, or pain noted. Go ahead and open and close. Move the jaw left to right. Any pain? No. Okay. You also want to do a cotton ball, the light sensation test. You want to make sure that he can feel all the sensation noted. So I'm going to have you close your eyes. And I'm going to feel on the left and right. Do those feel even?
Yep.
Okay, what about now?
Yep. Yep.
Perfect. You also want to palpate the sinuses. You want to check the frontal and maxillary sinuses to see if they feel any pressure or pain. Any pain or pressure from that?
No.
Okay, perfect. The next thing you want to do is you want to look at the eyes and the eyelashes. You want to make sure that the eyebrows are evenly proportionate to the face. And you want to look at the eyelashes to make sure they extend outward, that there's no drying, flaking, or discharge from the eyes. You also want to look for any edema or palpate for any edema on the lacrimal apparatus, which none is notated. You also want to look, just do a visual examination. You want to look at the sclera and make sure that the sclera on both eyes are white. You want to make sure that there's no discoloration such as yellowing, which could be a sign of jaundice. And his both appear to be white. You also want to make sure that you look at his conjunctiva, which is down below in the eyes. You want to make sure that those appear to be pink and moist. Any signs of any paleness on there could be signs of anemia, which none is notated. After you go ahead and look at the eyelashes and the face, you want to make sure that you're looking at the pupils. You want to make sure that when you shine a light on them, they constrict and react equally. So I'm going to take my pen light and I'm going to have you focus on a fixed spot across the wall, which they both do. We're also going to have him follow my pen light with his eyes, making sure that the eyes move together, that make sure that there's no abnormalities in any of the cranial nerves. So have you follow my pen light, just with your eyes. Which all looks good. That's just assessing the cardinal field of vision. You also want to have him do the cover and uncover test to make sure that there's no involuntary movements. So I'm going to have you focus on a fixed point. I'm going to have you cover one of your eyes. Okay, and uncover. Perfect. And then cover the other eye. And uncover. Perfect. The eyes move together and there's no abnormalities noted. You also, the next thing you want to do is move down to the nose. You want to make sure that the nose is midline and symmetrical and proportionate to the face. You want to have you tilt the head back You want to look at the septum to make sure it's not deviated, that there's no polyps in the nose, that it's pink, moist, that the hair is evenly distributed, which it is. We also want to check for patency of the nose. So I'm going to have you cover one nostril and breathe. Perfect. And I'm going to have you do the other side. Okay, sounds great. I'm also going to have, the next thing I'm going to do is check the mouth. The lips appear to be pink and moist, which is good. We're going to have him open his mouth. We're going to assess his tongue, his teeth, and the inside of his mouth to see for any abnormalities. So I'm going to have you open your mouth. And we're going to look around in the mouth itself to see if we have any lesions or any sores notated, which we do not. We're going to look at the teeth to make sure that they're white, that they're the appropriate number. Have you stick out your tongue and say ah. We're going to look at the uvula to make sure it's midline, to make sure it's not deviated to one side or the other. We're also going to look at the hard palate, and then under the tongue we're going to look at the soft palate. We're going to make sure there's no signs of oral cancer, and we're going to look at the tongue on the left and the right to make sure that there's no sores or lesions notated, which there's not. Everything appears to be normal. After you do the mouth, you want to move on to the ears, where you look at the ears and they're symmetrical to his face and proportioned to his the face itself. You also want to palpate the ears to make sure that there's no pain on palpation. You can do that bilaterally. Any pain?
No.
Perfect. We're also going to assess his hearing. The first test we're going to use is the whisper test. I'm going to step behind him. I'm going to have him plug one of his ears, whisper a word and see if he can hear it, and then we'll do the other ear with another word. Maybe cover one ear.
Red.
The other ear.
Orange.
Perfect. The next test we're going to do, we're going to use the tuning fork. We're going to assess air conduction versus bone conduction. We're going to do the Weber test. I'm going to strike the tuning fork, place it on the top of his head, and I'm going to see if he can hear out of his left, right, or both ears.
Both.
Okay, and then we're going to go ahead and we're going to also do this the rim test, which we're going to strike the tuning fork. We're going to place it on the mastoid joint, and we're going to have him tell us when he can no longer hear it.
Okay.
And then we're going to have him tell us again.
Okay.
Okay, perfect, which they all appear to be normal. After we do that, we're going to look in the ear canal itself. We want to make sure that they're translucent, that there's no drainage, no perforations noted. No pain. Looks good. And that looks good as well. Any pain with any of that?
No.
Okay. The next thing to do is we're going to move down to the neck. We're going to make sure the neck, we're going to make sure the skin appears to be soft. We're going to make sure that there's no redness, no rashes, no edema, that it's smooth in the thyroid and the neck area. We're also going to make sure that we don't see any jugular vein distension, and in this case we do not. The next thing we're going to do is we're going to do active or passive motion. We're going to have him press his head against my hand. And press against, there we go. We'll do it over here too. Awesome. And we're going to have you shrug your shoulders for me. Okay. Any pain with any of that?
No.
Perfect. Okay, next thing we're going to do is we're going to palpate the trachea. We're going to go ahead and feel to make sure that there's no deviation, that it's midline. Give me a swallow. Okay, we don't feel any abnormalities with the thyroid gland, so we don't feel any swelling or any abnormalities notated. We're also going to palpate the carotid pulses while we're here. We're going to do it one at a time. Perfect. I'm going to go ahead and also assess now the lymph nodes. We're going to start in the pre-auricular, move to the post-auricular, back of the head, which is the occipital. We're going to go move down to the submental and the submandibular. We're going to move down to the cervical chain, to the deep cervical, and the supraclavicular. And can you stick out your arms? And we're going to check the axillary nodes too, which there's no abnormalities notated. The next thing we're going to do is we're going to move down to the chest. We're going to visually inspect the chest first. We're going to look for rate of breathing. There's no labored breathing. There's no abnormalities noted. He doesn't look to be in any distress. His color is pink and warm and dry. We're not noticing any rashes or lesions. We're also next going to palpate the precordium. We're going to go ahead and place the hand on the chest. We're going to see if we can feel for any heaves, bruits, or palpitations. And then we're going to feel the apical pulse, which is the 5th intercostal midclavicular line. That can show signs of an enlarged heart. Next thing we're going to do is we're going to listen. First we're going to start listening to the aorta, listening for the S1 and S2. And then we're going to move to the 2nd intercostal left sternal border, listening for the pulmonic and the tricuspid, and the Erb's point, and the mitral, which again is at the 5th intercostal midclavicular space. While I have the stethoscope, we're going to use the bell of the stethoscope, and we're going to listen to the carotid artery, and we're going to listen to the thyroid, or the trachea, just to make sure we don't hear any swishing or bruise notated. We're going to make sure we hear a nice rate and rhythm. Sorry, the thyroid gland, not the trachea. Next thing we're going to listen to the lung fields. We're going to move bilaterally left and right, making sure we compare each side. Take deep breaths. Making sure you go back and forth to compare each side, one to the other in a very meticulous manner. Make sure you get to the bases of the lungs. We're also going to have him stick his arms out to the sides, and we're going to listen to the lateral aspects. Again, moving left to right in a meticulous manner, making sure that you're comparing each side to the other. We're listening for any areas that sound abnormal, for any crackles, wheezing, or ronca. You can put your hands down. Next thing we're going to go ahead and we're going to percuss the chest. We're going to percuss in the fields to make sure we listen for any dullness or hyperresonance, which can be signs of fluid consolidation. It also can be a sign of a collapsed lung. The next thing we're going to do is, which all appears to be normal, so the next thing we're going to do is we're going to listen for any tactile fremitus. We're going to go ahead and place the hands on the chest and have them repeat the word 99 and see if we feel any difference, any consolidation.
99, 99, 99.
Okay. Everything looks good. So I'm going to have you go ahead and turn around for me. We're going to go ahead and move to the posterior portion of the back. Again, we're going to inspect the back visually first. We want to make sure that we look at the breathing to make sure that there's no abnormalities noted, to make sure that everything looks good, that he's breathing at a regular rate and a regular rhythm. We look at the skin to make sure that there's no lesions, rashes, sores. Again, we're also going to listen to every one of the lung fields, making sure we move in a bilateral motion to assess for any abnormalities. We're listening for any wheezing, crackles, bronchi, making sure to go back and forth to each side in a meticulous manner, making sure you get to the bases of the lungs. We're also going to go ahead and percuss the back. We're going to look for any signs of dullness, hyperresonance, any signs of fluid consolidation or collection. I'm also going to go ahead while I'm back here, and I'm going to percuss the costovertebral ankles, which are a little bit lower. Okay. The next thing we're going to do is we're going to look at the diaphragmatic excursion. I'm going to go ahead and have him cross his arms and kind of lean forward a little bit. And I'm going to go ahead and percuss down, and then once I feel the spot of a change, I'm going to mark it. Make my mark. Okay, make my mark, and then I'm going to move up. Make my other mark. And then you want to compare the two marks. There should be at least about a 3 to 5 centimeter gap in between. which in this case is within defined limits. The next thing we're going to do is we're going to check, we're going to have him take a deep breath, and we're going to make sure that the lungs are expanding evenly. So I'm going to have you lean forward. I'm going to place my hands on his back with my thumbs together, and I'm going to have you take a deep breath. I'm going to make sure that the hands move in an even fashion, that one side's not pulling more than the other. And again, we're going to listen for any tactile, or we're going to feel for any tactile firmness by placing our hands on his back and having him repeat the words 99.
99, 99, 99.
Okay, everything looks great. So the next thing I'm going to do is I'm going to move on down to the abdomen. Maybe lay on your back there for me. Okay, perfect. So the first thing we're going to do is we're going to look at the abdomen itself. We're going to inspect it visually. So we're going to look from the side. We want to make sure that we see no signs of any abnormal breathing, any signs of trauma, making sure that we've noticed no differences there. And everything looks good. So we're going to go ahead, and there's no signs of scarring or herniation also. We're going to go ahead and listen and auscultate the bowel sounds in all four quadrants. You'll listen for up to about 2 minutes apiece, making sure you're listening for any hypoactive or hyperactive bowel sounds. We're going to start with the right upper quadrant, and the right lower quadrant, left upper quadrant, and a left lower quadrant. And then you're going to take the belly or stethoscope and you're going to listen to the aorta. You want to make sure that you're listening for the rate and the rhythm and for any bruits. Looks good. While you're here, you're going to move and you're going to listen to the right and left renal artery. So I'm going to listen to the left renal artery and the right renal artery, and the left iliac artery, and the right iliac artery, and then the left femoral, and the right femoral artery. Everything is normal. I'm going to go ahead and also I'm going to palpate and feel the aorta itself. I'm going to make sure that it's midline. I'm going to feel for any pulsation, pulsation, and I'm going to make sure that I'm measuring the width. Okay, looks good. It's all within normal limits. The next thing I'm going to do is I'm going to palpate and feel for the liver borders. I'm going to percuss for the liver borders, and then I'll make my measurements. And then you take the measurement and make sure that they're around the same area, and make sure they're within defined limits, which in this case they are. I'm also going to percuss the spleen. I'm going to start in the front. I'm going to have him roll up onto his side for me. And then you're going to continue to percuss the spleen area to make sure that you get a better visual and a better feeling over here to make sure that they're all within defined limits. Which in this case it is. Alright, you can go ahead and lay on your back. We didn't find any areas of any hyperresonance or any dullness noted. We're next going to go ahead and we're going to do some palpation. We're going to do light palpation first. We're going to feel for any nodules, lumps, and masses. We want to make sure that we feel the borders of the liver. When you get over to the spleen, you want to make sure that you're feeling for the spleen. I'm going to put my hand behind his back and I'm going to palpate the spleen area, making sure we do not feel it, which in this case we don't, which is good. That means there's no signs of an enlarged spleen. Then we're also going to do some deeper palpation. Make sure we have no pain with that. Any pain?
No.
Okay. I'm going to have you sit up for me. We're going to move on to musculoskeletal and to skin. I'm going to have you stick your arms out for me. First thing you want to do is you want to look at the arms. You want to make sure that the hair on the arms is evenly distributed, that there's no rashes, lesions, or sores noted on the skin itself, which in this case it's not. You also want to look at the fingernails. You want to make sure that they're appropriate as far as color and as far as shape. We're also going to check the capillary fill in the fingers. We're going to press on the fingertips and make sure that the blood comes back in a brisk manner, which is less than 3 seconds. In this case it is, which is perfect. You can rest your arms. We're also going to go ahead and check the pulses themselves. I'm going to check the carotid pulses again. You're feeling for rate and rhythm. I'm going to check the brachial and radial on each side. which everything feels normal. We're also going to go ahead and do range of motion while we're right here. I'm going to have you put your arms out in front of you. I want to push up. Here we go. And push down. Okay. Bring your arms out to the side for me. Push up. There we go. Pull down. Alright, very good. I'm also going to go ahead and check reflexes while I'm here. I'm going to check the brachial reflex. And we're also going to check the radial reflex. You want to make sure you see the flicker in the hand. Alright. We'll move on to the legs. I'm going to have you put your legs out for me. You want to look at the legs and you want to make sure that the hair pattern is evenly distributed, that there's no abnormalities, rashes, or lesions noted, which in this case there is not. You want to make sure that you're looking for also any edema in the dependent limbs, which in the ankles it has no edema. You also want to check the calf refill in the toes, make sure that it is accurate, which in this case it is. And then you want to go ahead and you want to check the pulses. We're going to check the pedal pulse, the popliteal pulse behind the knees. Okay, and then we're going to go ahead and check the post-tibial pulse. And the pedal pulse. To make sure they're all within defined limits, which they are. We're going to check the reflexes here. Which are, in this case, you'll just strike the Achilles tendon. Which looks good. I'm going to go ahead, we have one last thing to do. I'm going to have you stand up for me. I'm going to face that way. I'm going to bend over slightly. And you want to make sure that the spine is midline, that there's no pain, palpation, or pulling on either side, which in this case, there's no pulling. It appears to be even. Is there any pain?
No.
Okay, you can go ahead and stand up. That concludes our head to toe assessment. I hope you enjoyed.